Hello and happy Naturopathic Medicine Week. My name is Dr. Griffin McMath, and I am the Ambassador Program Manager at the Institute for Natural Medicine. And here with me today is Dr. Melanie Stein, a licensed naturopathic physician in Oregon who supports patients with complex chronic illness. So thank you so much for being with me today, Dr. Melanie.
Thank you.
I wanted to ask you some questions because you have a very unique story, and I know we talk all the time about how naturopathic medicine saves lives, but something that we don't always bring attention to is some of the people who go on to save those lives have had their own life saved by naturopathic medicine. And I heard through the grapevine that this includes you.
It does, yeah.
Could you tell us more about your story?
Sure, yeah. My story is a little bit of a unique story. I was diagnosed with Lyme paralysis 3 years into medical school, actually, on a Qigong retreat. And through that journey, I was misdiagnosed for almost 2 months. I spent in a hospital paralyzed without being able to be diagnosed. And it was actually my naturopath who said, you were just in the woods and you woke up paralyzed. We better run a Lyme test. And it was my naturopath at the time who diagnosed me and treated me because of the misnomers of Lyme disease. I couldn't find anyone else who would treat me. And so, she did treat me with aggressive therapies, but I, to this day have to thank her, my naturopath, for being the one to diagnose me.
Oh my gosh. And this was this an actual naturopathic physician too who had done this?
Yeah, so it was a naturopathic physician. So I was in the hospital for 2 months being worked up by conventional medicine for everything, and they couldn't find anything. And they actually went so far as telling me I just needed therapy. And, it was my naturopath who thought, let's dig in deeper here, because I know you don't just need therapy. You're doing awesome in school and you love school.
Right.
Let's get you better. And, and so it was her that dug in deeper and tested me and then treated me.
Right. And not that there's not stigma in paralysis related to any kind of mental health condition, but for you to say, hi, what I'm experiencing is real, and I want someone to figure out why is this happening. I am paralyzed, to be heard and to be seen, and to have someone run other labs and what maybe fit into an algorithm or someone's own perception. That makes such a huge difference.
Yeah. I think that's exactly it. And I think that's what naturopathic medicine does so well, is that, we don't treat algorithms, we treat people. And we really listen. We spend so much longer with patients than typical, medicine. We spend 45 minutes, sometimes an hour and a half. My new patient visits can sometimes be 3 hours even if it needed. And we really listen and we treat the person. And I'm thankful every day that that's what my doctor did.
Mm-hmm. I'm so glad and that you are doing better now, is what I hear.
Yeah, I'm doing great.
Great. We love to hear it. And something that we talk throughout Naturopathic Medicine Week is diversity within naturopathic medicine and all the different ways that can be. That can be, I think you told me earlier before we started recording, we talk about abilities or able bodies or different medical equipment that we need and what it's like to be even training as a physician. With that, can you speak to that a little bit and tell people what I'm kind of hinting at?
Yeah, so I was in a wheelchair for 2 years of medical school, and it was challenging. I don't think that our medical system and our student body structure was set up to handle that, to be honest. And I had many struggles through it, and I had to advocate for myself through that process to receive the accommodations that I did need. And really it was a learning process, learning how to redo physical exams in a wheelchair, learning how to, I was required to take, manipulation classes, and the doctors worked really well with me, learning, how can you do this, right? How can you, as, I don't like to call myself not an able-bodied person, but I guess I was, and how to do these modalities that we learn in school without actually being able to stand up and get over someone and pop a rib back in place, right?
Yeah.
And even just in clinic, how do I engage with patients? How there was definitely stigmas there, and people would treat me different. And, I think once I started talking and they heard, hey, this is actually a normal person. She's really intelligent. She's going to take really good care of me. People started to act different. But even just typing, using a computer, not being able to stand to look in the ear, right? It was all different. And I had to learn what I'd been training for 2 years how to do all over again.
Wow. I can't imagine. I think too, the creativity that may have taken, because we don't have a lot of professors in our field, or I can imagine just across medicine in general, to look to that have this, set out just like how we learn if someone's not in a wheelchair. So having that, do you think that gave you, what else do you think that gave you that maybe did not come in the books, as far as becoming a naturopathic physician?
Well, I guess a couple of things. One is, I think, my ability to listen, and I think even now in the time of telemedicine, that's paying off so much, because we rely so much on the physical exam. We rely so much on touch, and there were physical exams that I couldn't physically do for people. And so I think that my ability to listen and really hear what a patient's saying and process and come up with a very clear differential diagnosis, not discounting the importance of a physical exam, but in my case, learning how to practice medicine in a different way, and learning how, right now with telemedicine, we can't touch our patients. And we have to make these very clear distinctions of, do they need to go to urgent care? I'm not sure, right? And so I would say that really helped me. And, also just compassion. I'm specializing in this now. A lot of my patients are in wheelchairs. A lot of my patients are extremely high need, very sick patients. And having this patience with them, having this compassion with them, having this hope for them that they can get better. And this relatability, I think, is huge. Being able to relate to having these disabilities and learning how to live in life. And something as simple as, I lost a lot of friends through the process, right? People, unfortunately, they don't want to just come hang out with you on your couch all the time. And relating to my patients of, I know you don't want to go out, and that's okay. It's okay to take time to heal.
Yes. Yes. And so following what you just said, it really sounds like, this happened, you're getting better, you're kind of working through the challenges, even just getting through medical school. Now you've graduated, you're supporting that very similar patient demographic that you were in. And so you've become this bridge into what seems like a very vast disparity in healthcare system right now, where patients maybe are slipping through the cracks, or things are being misdiagnosed as mental health, or just saying that someone needs, talk therapy, when there's these very different processes happening in their body. So do you consider yourself as someone who kind of takes clinical investment into this healthcare disparity?
Oh, I mean, I think absolutely. I don't think I know. Yeah, I do. I think that there's so much that we still have to learn with healthcare, and it's called the practice of medicine for a reason. And, that's why I'm a naturopath, because I have the ability to dig in deeper. I have the ability to listen and respond and run specialty tests that, maybe some people would never know how to interpret, but we go through all of this extra training. I'm constantly learning. I've been in conferences the last 4 weekends in a row. I'm going to take a break this weekend, and then I'm in another 3 weekends.
Oh my gosh.
Because there's so much to learn.
Right.
And that's how naturopathic medicine shines, though, is because there's so much we can do with this medicine. It's not just, okay, we're going to be a cardiologist, or we're going to be this. And don't get me wrong, we need that. It's important, right? But we get to choose how we want to practice. Does that answer your?
It does. It does. And I want to touch back on something you said earlier, because as someone who has experienced this yourself, and now dedicate your clinical career to supporting this patient population. You know, I heard you talk about like, wow, I didn't really consider myself, you know, this phrase that I had used. But I imagine, you know, that's not something that I've personally experienced at this point or had anyone directly with me to the point of, you know, your family where I'm working with every day.
Yeah.
And I can imagine that with a condition or a complex chronic conditions that we don't even on a mass scale understand how to assess or diagnose, let alone treat. I can imagine the way that we talk about it, like the words that I use that are probably not accurate or even inappropriate, are also don't measure up. And so I'm curious if maybe you can give your thoughts on some of the language that surrounds complex chronic illness.
Yeah. You know, I think that in general, the word hope comes to mind. And I think that when I start to use terms as limits, if that makes sense, you know, starting to use terms that identify limits, we can lose hope. And so the language that I really use with my patients is more motivation. And, you know, so, you know, for instance, you know, I hear you that walking up this flight of stairs is really, really hard for you. And so you're having to sleep on your couch because you can't go upstairs. What would that feel like to be able to walk up the stairs again? You know, and really trying to redirect this language and this way that we talk about our illness into a positive way and to instill hope that you will feel that again. And trying to relate to it and saying, you know, talking about how it makes them feel and how hard it can be, but not saying this is a limitation.
So in descriptor words too, like, you know, before I got in the call with you, I asked, I can't remember which phrase I had said, but I said, you know, these are terms that I've heard to describe, you know, this list of conditions that, you know, I find on your website. And you said, oh no, I call them complex chronic illnesses. Is there a reason, like languages like not language, words like that are descriptors that are used in identifying conditions as a whole, or even the person who has them? Do you have thoughts on language there?
Well, you know, I mean, I think that the term you used was invisible illness, right? And it's not invisible, it's real, you know, and maybe you can't see it, or, you know, John can't see it over down the road at the checkout station, but the patient can see it. And so I like to name it how it is, right? You have fatigue, you have joint pain, you know, you're having all of these symptoms, because when we use terms that hide our illness, I think that it can make us feel different, you know, and maybe this is a personal thing, because for me, it was such a fight for people to believe I actually had Lyme disease. And, you know, and people didn't believe me because I looked fine. I just couldn't walk, you know, and there were times where I didn't look fine. There were times where I had full body tremors, but I didn't allow people to see those times, right? That's when I was home. And so, and especially as I was getting better and I would still have good days and bad days, you know, my symptoms were real. And so I try to call them what they are. And I try to put meaning to them and to put value to them and to validate the patient with them. Because so many patients, when they walk in my door, they come with this attitude of fighting to be heard. You know, they come to this attitude of, I've been to 15 doctors and doc, I'm really sick. No one's listening to me. I had all of this workup and they're telling me everything's fine, but I have such bad neuropathy, or, you know, weird symptoms that you would never think, and that you need to connect the dots. And for my patients, when I sit there and I put meaning to them, just that simple aspect of feeling heard, and not just being told, no, you don't have nothing wrong with you, or, well, you look fine, right? It validates them. And I think that that's what patients need sometimes too, is they need validation.
Yeah. I really appreciate your thoughts on language, especially. I had really understood some of these illnesses and conditions under a variety of different umbrellas as far as language goes, and they all, you know, when different providers explain the way or the reason why, like I'm like, okay, I can get it from that perspective, and With the ambassador program, we're very specific about the language we use. And so I always just like to check and make sure
Yeah.
and learn more about that. So I appreciate
Yeah.
you sharing.
Yeah, and I think it's important to check in with our patients of what language they want us to use too, because just because that's my opinion doesn't mean it's everyone's, right?
Right. Yeah, absolutely. As far as the way that, the future of naturopathic medicine, the future of your career, and this patient population specifically, how do you see, naturopathic medicine growing and evolving and continuously being sought out or even incorporated into conventional care, and the treatments and the accessibility of the treatment that these people have in store for them? How do you see that evolving?
Well, I think the biggest thing is I prescribe more pharmaceuticals than I ever thought I would prescribe. And I think what the beauty of naturopathic medicine is I prescribe them with a root cause approach. I prescribe them while doing a lot of other naturopathic modalities to help mitigate side effects or negative, so for instance, antibiotics, right? We treat Lyme disease herbally or with antibiotics. And I do both. There's not a right or wrong way. But when you're talking about long-term antibiotics, we need to protect the gut.
Right.
And so I think that it's so important with naturopathic medicine that we realize that we are amazing physicians and we have really good training and we get to utilize that training. And I think that, as more and more states open up their scope of practice, it's just going to be able to open up the influence that we can have on the population and our ability to help heal people, because we do look at people different and we do take time to listen. And, not everyone wants to prescribe pharmaceuticals, but I do a lot of IV therapy. I have a full IV room, and some of my patients, I had a patient today tell me, Dr. Stein, this is life and death for me, and these IVs are saving my life. And so, with our scope of practice, that's so important that we continue to advocate and we continue to keep these modalities open for us. And I think compounding medications too, right? I think that's a big hot topic right now. The compounding pharmacies are my best friends. They're able to prescribe things without additives and fillers and do minute doses of things, right? That you can't get at a regular pharmacy. And so, yeah.
AMP will love this video for that. I can see them now saying thank you. Well, this is so helpful and really important, again, for the general public, because that's who INM really speaks to the most, and not only potential or future patients, but also potential and future co-managing providers, fellow physicians, our MD, DOs, physicians assistants, nurse practitioners, or chiropractors, all of these different people who we can really work alongside, and we already often do. This message that you had today is really, like you said, hopeful, especially for future naturopathic physicians who may be in a wheelchair right now and know that they can go to naturopathic medical school, and that there is a way for them to learn how to do physical exam or to put a rib back into alignment, which I am so curious. I wish I could see you do that right now. So all these different things, I think you've given hope to those as well. So thank you so much for your time today.
Yeah, and I think, I just want to say one more thing, which is it takes a team. And so I think all of our professions are important, and there's no one size fit all answer to medicine. And the more that we can work together with all different types of healthcare providers to create a team within the field of medicine, it's so important.
Yes, absolutely. Our fellow MD colleague, and I think it's also AIHM's motto, they always say stronger together, and I could not agree with that more. So
Thanks for having me today,
Dr. Melanie Stein. And if you are a potential patient who needs support in this area, please don't hesitate to reach out to Dr. Melanie Stein or her practice. And for more information on naturopathic medicine, visit naturemed.org. Thank you, and happy Naturopathic Medicine Week.